one to be known as a therapeutic, the second to be known as a acupressure, that's called as a Tuina, is the gentle massage. Once you activate the gentle massage on that region, so that time that particular area, it scatters the energy. For example, why do you get the pain? But there is some kind of the stagnation of the blood flow, or stagnation of the chi, or stagnation of the chin ye, that is the body fluids. Due to that reason, patient will get the pain. So what you should do, first you do the Tuina massage on the affected region. For example, lower back pain, on the paraspinalis muscles having the pain. You just activate. You just activate on the back region. You just activate like this, right? You just activate like this. Then that area, it flow the blood blood flow to be taken place on that muscles. The muscle get congealed, then muscles get slightly dilatation. Then you insert the needle, then obviously having the great results. So in that way, we would like to do that. First we do the Tuina massage as a gentle massage, then you just apply the needle, but that having the great results. Number one procedure. Number two procedure are people who are the therapeutic experts, the Tuina experts. They wanted to do some kind of the manipulation as a therapeutic level. Then they have to activate some of the needle over that region. That also applicable in order to get the maximum recovery to the patient. So in that way we can do it. That's called as a Tuina massage. First you do it as a local application. For example, shoulder pain, he have the pain in that region. You just activate this region as a patting method, or this is a kneading method. This called as a kneading method. You just activate this region, the blood flows over that region, and then further insert the Qian Qing. Qian Qing is the extra point which is located on this region. Then you insert the needle towards the GB21. The patient have the great results. So then what is exactly the philosophy? You all know the energy flows through the meridians, but blockages or the disruption can lead to the discomfort, pain, or even illness. The Tuina to remove these blockages, allowing the energy flow freely, and then body heal itself. You know that once we just activate some of the areas wherever there is a stagnation. Normally you remember on the muscular pain, Tuina is very good for the internal organ disorders and also for the musculoskeletal disorders. In that case, so once what we should do, in the muscular system, normally we'll get the small amount of the muscle knots. So that muscle knots need to be done in the two ways. Number, once you apply the oil, on that region, and then try to do the padding. Once you do the padding like this, and then you come to know some kind of the micro or the macro level of the knots. So that knots need to be nothing but is the fibrocystic nodules. So that nodules need to be dissolved. The nodules need to be scattered. That means that stagnation is there, that need to remove. So for that, what need to be done? You just apply some turpentine oil, or maybe the rose oil, or some kind of the sesame oil or mustard oil, something you just apply. The local area in the Mexico country, which oil will be the cold, which oil will be the hot nature. Try to find out that kind of for example, cold syndromes are there. There you just apply the hot type of the oil, and then you just do the massage over that region. That how to do that procedure is the finger massage or the palm massage. You just do it. That have the positive results. So number two, here normally we use as a mustard oil for the cold related problem, olive oil for the heart related condition, something like that we normally use in India. Then further we'll think about the goal of the Tuina massage is to create the harmony by eliminating the blockages, and also this will be applicable to treat for the emotional issues as well. Even today, just now I have seen the patients are related to the around 35 years old, another is 34 years old. Just now they are lying down on the bed. So I can see they do have the emotional issues. But even the the teenagers, they do have the emotional issues where the related to the anxiety, depression, insomnia, stress related problem, and also the grief and sadness and worries and fear complex. This kind of the emotional problem also can be segregated by doing the tuina, because when you touch and then palpate to the area, some of the places, that directly indirectly will be helpful to treat for these emotional issues as well to the patients. So normally we do through the acupuncture, but even tuina also can be applicable, because the therapeutic touch, this is something is amazing, which I can say you, when you happily say and talk to them and then you touch them certain areas. So for example, when you touch and then palpate on the du20, when you palpate on the shenmen, palpate on the nikwan, palpate on the Taiyuan, that is the Buddha's triangle. But this also directly will be helpful to treat for emotional issues as well. And by the way, whenever you palpate, there are the fear complex, anxiety, they do have the problem. So in that anxiety, normally what we should do, we just activate some of the points on the back region, especially the people who are suffering for the back pain, and also they do have the sacrum related problem. When the sacrum area, you just palpate and then activate that region with politely talking to him, the emotion which is causing the anxiety, there is the fear and then inferiority and frightening complex, so that can be subsided once we do the tuina massage over on the holy bone. Holy bone is, which bone is the holy bone? Come on guys. Sacrum, right? So now the 5 element theory and then tuina. So how we are integratedly treating based on the principles of the Taoism, that's called as a Zhang Fu theory. Based on that perspective, we incorporated the 5 element theory, the fire, earth. So based on these principles also we will work, and to balance the yin and yang theory. This I will try to talk to you. Then wood and fire, earth, metal, water related problem, how we need to handle and then treat the patients by activating some of the points. So wood related problem. So what kind of the wood related problem? There is a hepatic organ and then fellal organ. That means it's the liver and gallbladder. Both are the reason to cause the wood related problem. Then we recognize the problem. Yes, is the liver having the issues. Due to that reason, the body pain and headache and vision related problem, muscular pain, tendon pain, sinus pain, they do have. Then you just activate the points on the hepatic region. So where the hepatic region is exactly located, this is the right side of the hepatic region. Palpate and do the padding on the wood region. So you are activating to this particular region. Again, you have to do on the spinal cord. There you just activate the kanshu and then the danshu and then ganshu. Both the points needs to be activated for the wood related problem. Then further there is the fire constitution, earth and metal, water. So in this way, whichever organ is affected, so which element is affected, and based on that we try to find out some of the solution as well, but I'll try to come for the therapeutic level. Then the yin and yang balance normally will happen. Here you need to recognize the chi. What is yin? What is the yang? There is the cold nature of the illness, the cold nature of the diseases or the disorders. So that to be in the winter season is getting the problem. That indicating is the in viscera is affected. Right. You look into the in viscera, the kidney and then urinary bladder, but majorly going to affect. Whereas in other, for example, heart and then small intestine, when the heart and small intestine both are the fire nature, but in that also yin and yang is existing. Now there is the yin organ is the heart organ. When the yin get excessiveness in the heart, that gets the blockages. Right, there is the chi level stagnation or the shui get stagnation because of the inexcessiveness in the heart, it causing the problem, where the yang is required to blood flow inside the heart system. So therefore that balancing to be taken place by activating to the tuina as well. Now advanced tuina techniques, we do have the circular rubbing method that's called as a ma fa. So ma For this technique is involves a gentle and circular motion that stimulates the skin and improve the lymphatic flow and promote the relaxation. So in this way, we just rubbing technique is the one important technique. So normally we use the rubbing technique, as I told you. For example, we need to activate for the Chu Chi point Li11. For example, I need to activate. You just use the rub on this region. You just rub like this and continuously. So with the palm, and definitely this will going to do as a padding or maybe as a circular rubbing. In this way, you just activate some of the points. That entire area to be improve the lymphatic system. You all know there is the chi and then blood and then chin a body fluids. The lymphatic flow to be known as a chin a. Chin, J-I-N, chin, Y-E-A, chin A, that to be known as a body fluids. Lymphatic system also one of the body fluid. So if that fluid is good in our body, then the lymphatic system is good, the drainage system is good. So for that, what need to be done? The major lymphatic system or the major lymphatic organ in our body to be taken place by the which organ? Come on. Come on, guys. Spleen. Right, spleen having the major role. So therefore, you just activate to the spleen meridian system. So that also to be activated. For example, the most imperative point to regulate the lymphatic system or lymphatic flow, that one single point, you just activate the pressure point, that to be known as a Kung Sun, that is spleen 4 point. Once you need not to necessarily apply the needle, to be also known as a Tuina technique. So no, not like acupressure, we just activate is the broad spectrum area in order to improve the spleen 4, to improve the lymphatic system as well. Then the both the hands on the medial side, we just use as a padding. So how to do that pressure is the padding to be taken place, that I'll try to show you. But here you remember SI1, that is the Shauza, Chiangu, Huxi, Wangu, Yangsi. There are the 5 points, you keep it in the mind. 1, 2, 3, 4, 5. The one is the Shauza and Chiangu, Huxi, Wangu and Yangu. There are the 5 points are located in this region on the SI1 to SI5. So that to be known as a, for the padding method or maybe the rubbing method, we can activate this region. So we can use 1, 2, 3, 4, 5 area. For example, on the cervical region, the patient having the pain, on the rhomboid muscles having the problem, there you just activate 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Exactly on this region, you just do the padding 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Like this, you just activate by activating this points. But patient himself, he can activate. For example, he do have the pain on the, so on my shoulder region I do have the pain, or the lungs meridian I have the pain, but you just activate. Once you activate in this way, so you remember 2 things happen over here. Number 1 is you are activating to the lung meridian, that is the Chungpo Yunmen, and also the pectoralis major muscles, you are activating this, but that indirectly activating to your pulmonary system, number 1. Number 2, once you activate from SI1 to SI5, remember, now you are activating to the lungs, but indirectly you are activating to small intestine, yourself you are activating. That indicating is, do you know the Taiyin? Taiyin, the lungs is affected. Now you are activating to the Taiyang itself. So Taiyang is SI1. Whenever there is a problem in the lungs meridian, but Taiyang also indirectly going to affect it. So therefore, to activate this indirectly, you are activating to the SI meridian as well. So that increase the blood flow of the fire meridian. So in that way, you need to activate some of the areas, especially on this region, by activating the 2 important points. You just remember, the one is the Chiksu, the second point is the Su Linchi. One is the gallbladder 40, then gallbladder 41, GB40 and GB41. There are the two important points. You just activate these two areas for the rolling method. Once you rotate on that particular region, especially on the GB40 and GB41, but that have the great effect to treat for the sprains and strains, and also any soft tissue injuries also can be applicable as a gentle massage. So the other one is the thumb pressing techniques for the acupoints. So how this has been shown that thing. So normally you can recognize the pressure. So once you activate this pressure, this to be known as a nail pressure, but the other one is the tip of the thumb pressure. This is as a cushion thumb pressure, cushion finger pressure. You just activate like this. This is as a cushion pressure. You activate this as a tip of the thumb, that pressure. So you just activate as a knuckle. You just activate some of the points with the knuckles. This is called as a head of the metacarpal bones. So once you activate some of the area on the back region or somewhere else, so through the knuckle method, that also can be considered one type of the Tuina. Then there is the another method called as a grasping method. That's a deeper and then more targeted approach. But where need to be done as a grasping means is the holding. So holding for a specific time. So for instance, the GB20 and then GB21 area. So where we need to be done as a grasping method. So I'll try to show you on the grasping method how need to be done. Right. So